Good afternoon.
So do you mind telling us your name, please?
I am Dr. Sonu Ahalawat, IVF and Infertility Expert, Director at ART Fertility Clinics, Gurgaon. We have come to Ghana to exchange knowledge with the Ghanaian people concerning the infertility problems and the latest technologies which we can exchange between the doctors, the gynecologists and the infertility experts from Ghana and India, and share our knowledge what all we do for these kind of patients. So IVF is in vitro fertilization. This is done for patients who are suffering, or couples who are suffering from infertility and they have not been able to have a child for quite a long period of time. So there are many factors which lead to infertility. It can be the male factor where the sperm count or the motility is low or the sperms are absent in the male, or in the female where there may be some problem in the tubes or in the eggs. So we help these kind of patients and the egg and the sperm, they are fertilized outside the body, and then the embryo that is transferred into the uterus of the female. This is what is IVF, that means in vitro fertilization, where we do the fertilization of the egg and the sperm in the laboratory outside the body of the female. No, see, nowadays the cause of infertility, it used to be thought that the infertility is mostly due to the female, but now we have half. It can be caused by the male factor also. So males are responsible for almost 40% of the causes for infertility, and 40% in the female, and there are 20% which are unexplained. So when the sperm count of the male is low, or the motility is low, or where there are no sperms, because of these male factors, IVF is quite a good technique which can help the couple to have a child. So the causes of infertility, it can be female factor or male factor, or both, and also there are certain factors which are unexplained. So in the female, the cause may be due to blockage of the tubes, that is the tubal factor. It can be due to ovarian factor, where the number of eggs is very low, or it is a polycystic ovaries, where the patient may be suffering from excessive number of eggs, and or there may be failure, premature ovarian failure, or even nowadays some menopausal patients, they want to have a child. So it can be ovarian or tubal, or endometrial factor, that is the uterus may not be very good to receive or implant embryo. Then in the male, what I said before, it can be due to a very low sperm count or a very low sperm motility, that the sperms are not able to move fast, or the sperms are absent. It may be due to also that sometimes there may be retrograde ejaculation or premature ejaculation, so there may be sexual dysfunction in the couple. They may not be able to have intercourse properly. So we can help those kind of couples also. Or there are some factors which are unexplained, and it can be so male, female, unexplained factors, or factors in both. Yes, lifestyle plays a very major role, and it can be a cause for infertility in the couple. In the females, if the body weight of the female is high, the BMI is high, so they may have problem in ovulation. Then, so this is obesity in both the males and the females. If the male is also obese, the quality of the sperm may not be very good. And then nowadays, due to junk food and certain addictions like smoking or having certain drugs and alcoholism, doing excessive gymming or taking gym products like steroids, these all can lead to infertility because the quality of the sperm or the egg may not be very good. See, before getting assessment for your semen count or your eggs, I cannot say anything, but still you should go and talk to your gym trainer or your dietitian and your fertility expert, and according to what is the condition of the tests which you have gone through, they may advise you certain things. See, age is very important when the couple, they are aiming to have a genetically child of their own. We can do a donor egg or IVF even when the female is menopausal. But still, if the couple or the female wants to have a genetically own child, they should go in for IVF at a younger age. Because as your age advances, the number of eggs in the female, which are limited, they keep on reducing, and even the quality is not very good if the female, the age of the female is like more than 35. So I would advise the couple, if they are diagnosed as having infertility due to some reason, to go in for IVF or any assisted reproductive technique at a younger age so that they may have a child of their own. I have been practicing IVF and infertility since the last 15 to 18 years, and success rates have increased as I have grown, and nowadays in good prospective patients at our clinic, we have a success rate of around 70 to 80%. Yes, failure of one cycle is not the end of the road for any couple. So there can be many reasons in the first cycle. So the doctor also knows maybe in the next cycle how to help the couple. And I would advise couples to keep on trying. So maybe the second or the third cycle would be successful for them. IVF can be done for a single woman or a single man or for a couple who are not married, but there are certain rules in every country, so the rules and regulations should be followed in every country for any procedure to be done. One IVF cycle requires the couple to be there for at least 4 to 5 weeks, and because the treatment starts according to the menstrual cycle, so they should be with the fertility expert 2-3 days before the menses start, the period starts for the female, and so certain injections they are given for around 10 to 12 days to make the eggs, ovarian stimulation that is called, and then after 36 hours of the trigger, we take out the eggs, we fertilize them, we make them a day 5 embryo, and if the transfer has to happen in that cycle, it is done on day 5. but sometimes we freeze the embryos and we try to do the embryo transfer in the next cycle. So as it is dependent on the menstrual cycle, so that's why this treatment is a little longer, and so the patients may have to come to the clinic for around 4 to 6 to 8 weeks. This is the biggest myth. The babies which are conceived by IVF, they have almost the same abnormality ratio what in a normal population is as it is in the general population what they have. So even if a lady, she conceives normally, the risk for her is almost the same if they have the risk like due to IVF, the baby may have a risk. So it is the same as in the general population. Okay, so this is also a very big myth that after IVF, the lady requires total bed rest. So we do not advise bed rest to a patient who, after we do the embryo transfer, she should go in with her normal lifestyle, whatever she was following, except that she should not do very heavy exercises or anything, but she can go about her daily routine, normal life, going to office, doing her household chores, making food, or doing whatever she wants. So no bed rest is required after IVF. It is only for those patients who may have certain complications later on in pregnancy. So that is whenever the obstetrician advises them to go for bed rest. Otherwise, due to IVF per se, no patient requires bed rest.
Hi, sir. Good afternoon.
Good afternoon.
And you're welcome to Ghana.
Thank you very much.
So first of all, I'd like to welcome you officially to our channel and thank you for granting us this interview.
Thank you very much.
So ART Fertility Center from India is partnering with Family Health Hospital, and we've happened to have conversations with Dr. Sonu and Dr. Rebecca. They have given us a brief of what we should be expecting with regards to the collaboration. But first of all, since you're the main brain behind the clinic that will be running, fertility clinic that will be running, and ART Fertility Center, we want to know what inspired you to come all the way from India down to Ghana for this project.
I own a company called Health Plus Inde.
Okay.
And this is not my first visit.
Okay.
This is my 5th visit to Ghana.
Wow.
And I have been coming to Ghana for the past 10 years. And we have been organizing so many specialty OPDs in Ghana, the clinics and surgical camps. So last month, that means in June and July, we organized a renal transplant camp in Ghana. This time we came with the fertility specialist, and next time we may come with some more specialist.
Okay.
So the reason is, culturally and historically, Ghana and India, they both share the same roots. And recently, as you know, European Union has become the 21st member of the G20 group.
Okay.
So that is another thing. And the motive behind all this, organizing all these events, we want Ghana should be the medical hub for all neighbor countries. So instead of going to other countries like Europe and Asian countries, people around Ghana can come to Ghana for the medical solution. So that is the main motive.
So in other words, Ghana would be like a medical hub and more like the African Europe, where people can get
Why not? You can say that.
Where people can get special treatments.
Definitely.
Okay. So
That will also generate some employment for the locals.
Yeah.
And people are suffering.
Yeah.
And there should be education, medical facilities for all. And it should be as much as affordable we can make it.
Much affordable if we
Yes.
can make it. So what are other plans you have in mind to, aside this fertility project?
The bringing Indian doctors from India to Ghana is so we can exchange the idea. We can exchange the technology. There are so many good things in Ghana, and we are impressed very much with the facility that we have. So why can't we have, and why can't we make treatment cheaper for the patients?
Yeah.
So next time maybe we'll come with the orthopedic surgeons, so patient can get their orthopedic surgeries done in local hospital by the Indian doctors. So that is the next plan.
Great. So it's believed that India is one of the biggest health and medical center in the world.
That's true.
How impactful do you think this is going to, or what are the impacts do you think your project is going to leave in the lives of Ghanaians and other African countries?
It will make the treatment cheaper. That is the most important thing. Earlier there was hardly any renal transplant in Ghana. But since we Indians started coming to Ghana, now you see every month we are coming and we are doing surgeries. Like tomorrow we have one transplant, renal transplant, and day after tomorrow we have 2 transplants. So this is a big change.
It is a big
And I'm sure in near future renal transplant can be done by Ghanaian doctor themselves.
Yeah,
Yes.
that's very.
So this is all not just bringing doctors from India and get the consultation done and surgical camp done. That is not the motive. The motive is the major surgeries can be done by the local doctors.
Okay, so you're talking about major surgeries being done by the local doctors. How do you intend using your platform or your company to do that? Because it's believed or it's rumored that most major, both private and government hospitals, especially the big ones in this country, do not have specialists. So for people to have special issues attended to, especially surgeries, have to fly all the way out of the country to maybe India, Germany, France, US, Canada for those special surgeries. So how would this have an impact on the life of the doctors in this country?
It is a myth. We have all the possible facilities in Ghana. We have infrastructure, we have good doctors. The only thing we need to believe them. And the way we are going forward, you will see yourself that in near future what all surgeries we are doing it. And it is not right to say that only Indians can be the specialist of some surgeries. Even Ghanaian can do that.
Yeah.
There is no doubt about it. So it's a matter of trust. And I think we all Ghanaians should trust their people, their doctors. They are there to save their lives.
Well, we should trust Ghanaian doctors. They are here to save our life. So,
And sorry to say, I would like to add one thing. These surgeries, these complicated surgeries are not done by only the Indian doctors. They are done with the collaboration with local doctors. So they have their equal role.
they have their
Yes.
equal role. So from Family Health Hospital, is there any other hospital you would be visiting or running this project on?
Yes, we are doing with the similar projects. I don't want to name right now. I think it's not the platform. But yes, we are doing with other hospitals also. There are public sector, public hospitals and the private hospitals as well.
But for this time, the focus is on fertility.
This time we brought the fertility, because there were a lot of queries from Ghana. So why Ghanaians should go to India? Why can't the Indians come to Ghana? So we are enjoying the weather, we are enjoying the place.
Yeah. So, and this is off the record, but what is your favorite Ghanaian meal?
Of course, jollof.
Ghana jollof, indeed, it is. But have you tried any of our local dishes aside
Yes, of
jollof?
course, I have tried plantain, red bread.
Okay.
Yes.
Oh,
and tofu, yes.
So, you've tried beans.
So
That's very
I think I'm the most lucky person. I got also my non-citizen Ghanaian card. So
really?
yes, I'm proud to say that I'm half Ghanaian now.
Okay, that is wonderful having me, and thank you so much for
Thank you very
this
much.
project.
Thank you very much.
And we're looking for more projects, and maybe you should also try something on the youth, maybe mental health or
We would like to start the one project which is called telemedicine.
okay.
So if somebody wants to get consultation by the Indian doctor, any Indian doctor, they don't need to move from one place to another place. It is just on their mobile. They just download the app and contact our Indian doctor.
So they get the consultation.
They can do the consultation.
And medication prescription as well.
Yes, of course.
So is this an upcoming project? Maybe with the
We are working on that.
health involved and all that you're working on?
Yes, we are still working on that.
Go deep
Yes.
into it. Okay, so they're working on a lot of projects, and thank you so much. We'd hope to see more of this. and
Inshallah.
We
Inshallah.
pray that the Ghanaian medical sector would be changed through your impact.
Inshallah.
Thank you so
Thank you.
Thank you so much. So guys, that's it, and it's a wrap.